now we move on to Paul Moulton from Isle of Man Television. Good afternoon, Paul. Fast am I.
Thank you. I understand you're being under pressure on 111 service because so many people have now got worried about this, and it's understandable. It's what everyone is talking about. My mailbag is full. I know yours is. Are you actually honestly saying that if people don't take their second dosage, they go right to the bottom of the queue, or will they just go back to the bottom of that particular banding? And you say that the clotting isn't showing up on the second dosage, but there's not enough data yet because of the very nature of this to show anything at all. Is that correct?
Well, actually, Paul, if I take the last point first, with all due respect, there is a lot of data. There's actually more data on this vaccination than most other vaccinations because of the sheer volume of vaccinations that have been delivered in such a short period of time. Like I say, this is exceptionally rare. It's 79 cases out of 20 million vaccinations delivered in the UK. I gave some figures there as well. In fact, it's actually less, like I say, this form of blood clot that's been associated with other medicines that can be delivered. So I would urge people to actually still take the AstraZeneca vaccine if it is offered to them, because the odds of anything occurring is actually absolutely minuscule. What I would also say, Paul, is just to be clear, I was referring to people who've cancelled first dose, not second dose. People who've cancelled first dose, we would urge people not to cancel second dose at all, because that's what locks in protection. We don't know what happens longer term if someone's had one dose but then doesn't take the second, because this is a 2-dose regime. It could well be, but again, the data's early yet, that they find the first dose eventually dissipates and they have no protection at all. So we would urge people to have the second dose as planned. Every single case identified in the UK, all of the cases identified in Europe, they have all occurred after first dose. There has been no identified, flagged, as far as I'm aware, in any jurisdiction. And I think it's 64 countries that use AstraZeneca now. There hasn't been a single case that I'm aware of that has been flagged after second dose. So we would encourage people to continue with the dosing as normal. So it is natural people will be concerned, but the JCVI, the MHRA, and also the European Medicines Agency have been looking at this, and the advice from all three organisations is people should continue as planned. The JCVI, in their words actually yesterday, an abundance of caution was the phrase they used. They said it wasn't due to safety concerns, it was due to an abundance of caution, is recommending that where available, an alternative should be used on the under 30s. And to be absolutely clear, the advice is if an alternative isn't available, then the under 30s should still be vaccinated with AstraZeneca, because the benefits still outweigh the risks. I'll bring the Director of Public Health in case she's got anything she wishes to add.
Not really. You've given an extremely comprehensive answer, and your earlier discussion about relative risk also covered everything. So all I can do is say that I support what you've said, and you've given a very comprehensive response.
Can I just ask you to clear up though this second dosage now? If they don't turn up or cancel whatever, but they need it within this sort of particular time, what happens to them? They do go to the very bottom of the list, or will they be put at the bottom of that particular banding?
Well, as far as I'm aware, Paul, we've not got a problem with people cancelling second doses. It's people who were booked for first doses, I believe, that have been cancelling. If people cancel the second dose, like I say, it should really be delivered within 12 weeks. If they, through personal choice, decide to cancel that, they have to recognise there is an associated risk, because the scientific data isn't there really past that 12-week point to actually say what happens to that first dose longer time. It may well find that the effects of the first dose dissipate and that they've actually harmed their protection from that first dose. But like I say, there has been no issue identified with anyone anywhere from AstraZeneca in relation to second dose, even in these exceptionally rare circumstances that, like I say, across a population, the risk is 4 in a million, which is infinitely small compared to other medical procedures. There actually has been nothing identified for second dose. It's all occurred after first.
And 111 coping okay?
111, I believe, is coping okay. I'd like to thank the team on 111. They've done an exceptional job, particularly over the last month and a half, where they've been, really put to the pump with various things, and they've coped admirably. But I believe they are coping okay.
Okay, and can I just check with the Education Minister that the preschool, the key workers can get their children into all sorts of support if they're single or they haven't got anybody that they can give the children to. Just being asked to verify if that applies to those sectors as well when you open the schools.
Well, thank you, Paul. What we've decided at the Council of Ministers today is that from Monday, that we'll be working with the preschool sector in terms of childminders, nurseries and playgroups to allow them to open, and hopefully that will provide those places to vulnerable children, those key workers. On Tuesday, our primary schools will be open again to vulnerable children and those essential workers. What we're asking, though, is only use this provision when you have to go to work, when there's no other alternative. And we have already allowed various other alternatives in terms of friends and families for those single parents in terms of teaming up with another household. What we're trying to do is pick up from where we started at this outbreak. But as you remember back in March, when we adopted this system, unfortunately, we had a spread right throughout childcare. And so we're trying to do it in a very phased way so that there's no chance of that happening and we don't have to go backwards again. So I just ask people to bear with us over the next week. We'll be doing our best to accommodate all those people who need childcare and need education for their children so that hopefully on the 19th, we can open things back up to a degree of normality.